Hi, my name is Dr. Mike Gorman. I wanted to talk a little bit today about carpal tunnel, in particular, a little more natural or holistic approach to carpal tunnel. So traditionally, the carpal tunnel is right here in the wrist, and when I used to work in sports medicine and physical therapy clinics and things, we put our whole focus on this area by doing things to reduce the inflammation here and do therapies here. In other words, everything, the whole approach traditionally is focused on there, and sometimes probably less than 10%, but sometimes 10% of the time, it's so bad here that we do need to either focus on there or do surgery and do therapy and stuff like that, and people get great results. But in my experience, probably 90% of the people I've seen over the last 20 years, and we see a lot of this, the problem actually comes from the neck, believe it or not. So the nerves in the neck, in particular the lower neck, those nerves come down the arm and they supply the carpal tunnel and they supply all these muscles. There's actually a number of different spots where the nerve can get trapped, or what we call an entrapment, coming down and affecting the carpal tunnel. So it can be affected in the nerves in the neck here, behind the shoulder, behind the elbow, in the middle of a muscle right here, and at the carpal tunnel itself. And so there's a number of spots that we evaluate, and any of those where the nerve's trapped have to be addressed, or you're not going to get long-lasting results. There's also a relationship with carpal tunnel where the vitamin B6 is actually like a natural diuretic and a natural anti-inflammatory, and people become deficient in that. That will actually cause problems in the carpal tunnel, as well as different types of nerve pain, neuropathies throughout the whole body. So we look at that. But of course, at any time there's an inflammatory condition, we're looking physically, nutritionally, and stress-wise, which we talk about on other videos, at what's actually causing the inflammation. So there's a number of different things that we do related to carpal tunnel. But like I said, if you had told me 20 years ago that 90% of carpal tunnel came from the neck, I would have thought you were crazy. My first few years of practice, I focused here, didn't have great results. Then I focused here and checked some of those entrapments, and I had a little better results. And then as I really focused on the neck and all these spots and the B6 and decreasing stress and looking at different things related to inflammation, then we get excellent results with that. So now we try to combine, like we do with everything, the best of traditional medicine, traditional therapies, things like that, and alternative and holistic. And when you put them together, hopefully that enables us to get you the best results quickest, and then because we're addressing the root cause, actually have the results last. So for more information on carpal tunnel or anything else that you might have going on with your health, please visit our website, www.gorman-health.com, and check us out on YouTube. Thank you.